So, Curtis, you're here today after your hammertoe surgery that I did, about a month ago? And the reason why we're doing this video is really not because of your hammertoe surgery, which, I mean, was a successful surgery because I'm actually letting you go after today, but because you have such an interesting story about how having hammertoes ended up saving your life, right?
Yeah, if it hadn't have been for the pre-op screening
Right.
for the surgery, I wouldn't have found out that I had three major
Right.
heart blockages.
Right. And interestingly enough, remember how it started? We ordered a circulation study on you, right? And we knew that you had some circulation issues, so I said, okay, you're going to go and get a vascular clearance to be sure that, you don't have blockages somewhere else, because if you have blockage in your legs, guess what? It's all about plumbing, right?
Yeah.
So I think that led you to go to an interventional cardiologist, Dr. Siddiqui, who found out you had 100% blockage in your heart. So you ended up having a heart cath. You had some stents put in too, right?
No, triple bypass.
Triple bypass.
Right.
I didn't realize it was to that extent. Okay.
Right, stents wouldn't have
Would
done
have,
it.
yes. So okay. So basically, that saved your life, right?
Right.
So from a hammertoe surgery to a triple bypass surgery, back to hammertoe surgery, but here you are sitting, 8 months from when we first started talking about your surgery, and you're still walking, still talking, and it was a coincidence. And that's why people, when they start fighting and say, listen, why do I need all this preoperative stuff? Why do I need the circulation studies? Why do I need, a stress test? I think you're such a great example how the preventative and screening tests can save somebody's life. Don't you agree?
Right. If it hadn't have been for a sore toe, I wouldn't have been here. If it wasn't for the screening that you had me get, I might not be here today.
Right. Well, thank you so much for your testimony. I mean, I think it's such an interesting example because, God has it in His own ways, huh? How we find out. So, all right. Well, thank you so much.